Next up, and the end of this little afternoon session of speakers, we have Kim Tran. If y'all haven't met her, she's with Boat People SOS down in Bayou La Battery. Kim is the community health worker, and she's a program coordinator down there, and she does quite a bit of outreach, so it's in an unofficial capacity. But she's leaned on quite heavily by that community and by response organizations to be a voice for that community. So Kim doesn't have a presentation for us today, but she's going to talk about her role and her experiences down in Bayou.
Thank you for having me, and good afternoon, everyone. So I'm a community health worker. I'm actually was trained by Tulane and University of South Alabama. And my program we started was actually funded by the BPOS bill. So I'm a product of that very first program. So we are actually, as our regional director had called us, with the first responder for our community when anything happens. So Bayou La Battery is a very small community, but even though it's small, but it consists of other community too, which is Golden, Dolphin Island, Irvington, Grand Bay also. So we are surrounded by those little small community, and we're very rural. So health is an issue for us. We only have 2 clinics there, and as I was sharing with our group, we only have 1 ambulance station down there. So, and then during the hurricane, I didn't know this, but all of the ambulance were, had actually had to be housed in Sarah Land, so which is really far, and our closest hospital is about 30 to 45 minutes. So, which transportation is our big barrier, and for the people down there, health is not that it's not an issue, but it's not to them. Sometimes it's not important because making a living, taking care of their family, is more important. And then majority of them do not have insurance. And since our state is not do not have Medicaid expansion, so which means we're still without insurance. So going to the doctor is something that been put back unless I'm really sick and I can't work, then we go to the doctor. By then, sometimes it's really bad already, so which means we end up going to the emergency room. So for us as the first responder and for the clinics, they are trying to help our community as much as they can, which they also implement in their clinics now. The mental health part, that's a big issue, especially during the oil spill. We've seen that where domestic violence went up that we don't know about, and then the men are, drinking a lot more, and the women are getting depressed because they don't know what they're going to do next. So mental health is an issue, and then also mental health is a stigma over there. So they don't want to talk about it. They don't want to think they have a mental issue, even though it's an illness. But part of trying to get our community to understand their illness or anything that they're going through, it's kind of sometimes it's a big barrier for us to explain it to them. So we try to have a lot of different programs to educate them, to get them to understand illness, the chronic illness or the mental illness that they have. Is not you're not crazy or anything like that. Just so that when we try to implement a lot of programs, it's kind of hard to get people to go in to sit down and try not to make them think that we're trying to teach them something, but just some information for them to know. So or Mostella, they do a lot of different program in prevention. Anyway. So we have the breast and cervical cancer program, and sometimes I think it's still hard to get the women to go to that because their thing is I don't have insurance, so I'm not gonna go. But once they know that it's out there, then they will go. But then it's the the only different thing is the difficult thing is when they go for the follow up, especially those that go to get a mammogram and then they suspect something and then they get scared so they won't go. And I think that's our big issue of getting people to go do follow ups. And then just to get them to go to their doctor, transportation has always been one of our big issue. They, especially those that have to go to see a specialist. So everything is in Mobile, which means they have to find a ride or pay somebody to take them to the doctor. So I think health, even though the clinics try really hard to get our patient to get the best quality health care that they can get, but if they can't get to the other doctors, then that's a big issue. So part of the, not really the job that I do, but I do it anyway, is to do, take the patient to the doctor. Technically, I can only supposed to be there to translate, but because if I don't take them, then they're not gonna go. That's one of our big barrier, and also the language barrier too. A lot of them do not speak English, do not understand a little a word, and then trying to explain it to them. That just say if they have thyroid, so they're like, wait, is that cancer? And, they get scared and they don't want to go, or even just to get demands to go do their colonoscopy. They hear so many different stories, so we have to kind of like talk them into like, no, that's not it, and the myth and every tale there is. So part of it is just to be there to support them. So sometimes we push them to go, which means I had to literally get up at 4 in the morning to come pick them up and make sure that they have to be there, and then to go see the doctor afterward too. So just trying to do the prevention part is a big deal for us too, because their thing is prevention, but I'm not sick, so I don't need it. So that's a big issue for us. But we also do support group. So we have a senior program at our office that they meet twice a month. Just sometimes just for them to be there to interact with each other, because a lot of them are they live alone, so they don't have anyone. So for them to come just to congregate and just to talk, sometimes just talk about nothing or about politics. But we can see that some of them that do come to our meetings, they're they feel a little bit better. But those that can't go out of the house, then that's a problem too, because we have quite a few that can't go. So some of them are like, I want to come, but I don't have a ride, I can't get there. And then sometimes when they don't go out as much, and then when we see them again, I can see that their health is declining. So sometimes it's like, what do you do for them? We can only do so much. So that's one of our big issues too. And then so we have right now, and I think our senior is going through. A lot of them are getting onset dementia. Trying to get them to understand what it is, and their thing is only, I just get forgetful. no, it's an illness, but it because that's age, that's normal, that's it's okay. But there's no but then when you go into with someone with dementia where it's now he has psychosis, how do you help the patient and the family that's taking care of him with this? I was racking my brains like, how do I get information on dementia in Vietnamese to explain to the client and so the family who's taking care of them. And then he has the doctor has gotten the home health care nurse to come to just to check on him and make sure he's taking his medication. So he's not taking his medication. And when we try to explain to him why he needs it, and it's not even like, oh, so you don't hear voices or things like that, but it's just so you can feel better. But he doesn't do it, and the family goes, so what do I do? Then, I don't even know what to tell him. It's heartbreaking. It's like, just make sure he takes his medication so he can feel better. And I think that's all I can tell him too. So getting our community informed, educated is very important. So that's why a lot of time I try to go to different workshops so that I can learn about things and information so I can bring back to our community. My thing is if we can give our community the knowledge, the information that they need, maybe that will be helpful for them, and that so they know how to take care of themselves and how to empower themselves too. Because a lot of time during the oil spill, a lot of people come and tell me, so I don't know what to do now because fishing and shucking oyster and peeling shrimp is their livelihood. So what do I do? And then when you see, then the depression comes in. And then when they go to the doctor, they don't want to tell the doctor that they're depressed because then they don't want the doctor to think that they're crazy or something's wrong with them. So how do we do that? So, we try to have different programs to help our community to kind of get back on their feet. So, and I know a lot of them are talking about, we need something stable, a stable job. We need a job, period. I have one that the past few months, he shucks oyster, and oyster was not, there was no job. They maybe work once a week, twice a week. So his thing is, do you know there any job that's hiring? I don't care what it is. So we are still battling with the oil spill. I know everybody think, well, it's back to normal. Everybody's out shrimping, but it's not. We're still affected by it. The shrimping industry is down. One of my senior went. The price is lower, but the oil is higher. So what do? We come in with we don't make any money. So how do you answer something like that? How do you tell them just to go on? Their thing is I don't know. What do I do? How am I gonna make a living out of this? So and our only thing is to encourage them to do the best they can and make sure that when they don't feel well, to go to the doctor. And then it's always, if you need anything, call me. If you need to go to the doctor, let me know. We'll be there. And then I always tell them that if you can't pay for a certain thing, the clinic will work with you or the doctor will work with you, so that to get them to go to take care of their health, because health is always the last thing they think about in our community. So. I don't know, Beth, do you have anything that
I just want to add that Kim is such a valuable resource to our area, by just promoting, especially in the different cultures that we have, promoting them to come to the clinic, to utilize resources that we have that are really qualified listeners, to be there to translate, so many growing up in that area, so many have laid on their children to translate for them in certain situations. And, when a woman possibly having a miscarriage brings a 9-year-old son to translate for her, that's a very uncomfortable situation. But in the past, we really have a lot of other resources. Now having Kim in the area, we actually employ other people that are bilingual as well. That anytime we've ever called on Kim, she's been able to be there for us. She's always advocated for the health center and knows that we have resources. She serves on our board of directors, and that helps her be safe as we look at the resources we're putting in place, how we're growing, how we're expanding, and ways she can use it to help infuse it into the community that we are there and are wanting to help everybody.
I've got to add on, and a big shout out to the Mobile Advisory Board, which was started during the oil spill by Project Rebound. They were able to have grants to give out to a lot of different organizations and agencies. So, but once their funding ended, it kind of stopped. But my then supervisor decided when I came in to for a way for me to get connected with other agencies, he had started back that group. So once he left, it kind of got thrown to me. So, but now we meet once a month. So all kind of different agency and come and we share our resources. And then a lot of time we do have we call it a health event. It's actually a resource fair. So they come down to the community, and a lot of time we get other agencies that haven't been going to our meetings. They will want to come to bring. My thing is to bring the resources down to our community, because a lot of time we, our community can't come down, come up to Mobile to get the resource, or they don't know there's resources out there. So they come down to help our community, and they are always, willing to come down because we always have it on a Saturday. So that's the good thing. And then we keep in contact with all the a lot of our agencies. So our thing is anything that comes up that our client or somebody, they have a question or they're looking for something that if I don't know, I know that I can always call someone from our group, and then they are so willing to help. We even have one day one of the group from Birmingham. They were looking for a place to do a training, and all I did was show an email. Look, they're looking for, and everybody was responding, and they couldn't believe how much the group was willing to help. So that group, to me, they're awesome. They all work so hard to help our community, and they are also always willing to help. And then we kind of help each other. We support each other. That group, we actually have gone to a few trainings. We did the mental health first aid together, training together. I think we did in 2 classes because they were only doing 30, so we actually ended up with 2 classes of that. And then we have we take on topics sometimes like we did suicide prevention. We have someone from Lifeline Counseling come to talk to us about suicide prevention. And then actually one meeting we actually sat and just talk about suicide. And when we start sharing some of our issue with just about suicide, not knowing that I shared with them that I've gone, one of the young gentlemen I was hoping to go back to get his GED, he actually committed suicide. And then, his mom is one of my mom group, and then he has siblings that were in my youth group. And then his grandma is one of my senior. So it's like, I have a whole family kind of have to be there for them. But then when we had talked about that, then one of the other lady from our group, she said her family she had an uncle that had suicide and a cousin had suicide. So just for us to be able to even sit down and share some of our issues, our problem, that was a big thing for us. So that group, I don't know what I would do without them, but they're awesome. We have a Facebook for that. So when we have event, we share on Facebook so that everybody knows. And we also have a website for other organizations to come in. So if they're new, they can always look for something and click it'll go onto their website. So that's one of our way of keeping in contact with the resources that in our community.
Thank you. If I could have the other speakers for this afternoon just come up a little bit, take any questions we might have from your talks. I'm going to adjust the schedule because it's my prerogative to charge up here a little bit. So right after we do the Q&A, we take a brief break before we go into our afternoon breakout sessions. But right now, anybody have questions for our afternoon speakers?
For Ms. Kirkland, what Carl was going to ask, and unfortunately had to leave, was, is there actual studies and proof that the cancer in Alaska for the workers from the Exxon Valdez case, that cancer is actually...
No, that was a misunderstanding. It's not the Exxon Valdez, it's World Trade Center. Exxon Valdez was kind of, they were saying 90% of the workers had died because of their exposure to dispersants.
Okay.
And when I checked, Exxon Valdez, half the labor force was union, half the labor force was locals. So I don't have anything, I have no information on the locals. I do have information on the union workforce. And what the one person told me was, no, not only are 90% of them not dead, 90% of them are still working. So, that's a big difference.
Okay.
So yeah, no, the World Trade Center is where we're finding 10 years out. On dispersants, we have nothing. Of course, Exxon Valdez didn't use that much in the way of dispersants. By the time they got the dispersants up there, they figured out that what they were doing was kind of, one of the speakers said, that they learned a lot about what not to do. And dispersants were one of the things they decided not to do after the other errors. So yeah, no, I'm sorry if you misunderstood that.
Thank you. Also, Captain, Hokkaido, you mentioned how there's just not a lot of that expertise spread around to all the local communities. And I'd heard, I'm not sure if it was a response or training, I think it was an actual response where somebody had worked, I guess, with the local government to set up kind of like an on-call nurse type of a thing because there was such a big community impact. I think it's at XTC in Houston. But they tried to set something else up instead because there's a lot of people, instead of everybody just rushing to the emergency room, there might be something going on. They tried to set up like an on-call. And I thought it was a great idea, but then you look at who would actually be the person running that, and would they have the background to really, from an exposure standpoint, have the knowledge base to accurately, give that information. I was just curious what your thoughts would be around something like that.
Yeah, what you have to have is resources to have, like somebody like the University of Illinois Chicago, which has a training program both in occupational medicine and in toxicology and in emergency medicine, to be able to answer the calls from those folks. And what we try to do in my organization is have calls come in from the primary care providers, be it a nurse practitioner, physician, PA, and then respond to them so that they know not only, because what happens then is they not only know how to respond to the first patient that they saw, but then they've got an idea of what to do with the next three. So that's what we try to do.
I don't know if the effort of maybe trying to get ahead of that, we get some free information of, if you're feeling this, and this, absolutely go to the hospital. There's just so much out there, especially if you have a large atmosphere.
Yeah, and it's one of the problems you run into with that is
affectionately referred to as med student syndrome, is if you put out all the symptoms that you should go see the doctor,
Oh, yeah.
they start getting them. Yeah. So we try to respond, and be ready to respond. So when something happens, we've got somebody on call who can, understand what those situations are. And so that's one of the things that we try to track. There's a lot of concern when the nuclear power plant in Japan blew up, and there were people on the West Coast who were panicked that all this nuclear waste was going to go over. So happens one of our physicians is Ukrainian and responded to Chernobyl, and so we asked him, to brief our physicians on the West Coast as to what sort of questions they might get, and he was available if they had further, but he at least briefed them ahead of time. As soon as it blew up, he said, "This is what we need to be able to do." Yeah, we try to be proactive, but sometimes you can't.
Yeah, I have a question for Dr. Gill. Preparedness. Prepare to respond, or prepare to prevent, or prepare where, if you had
Yes.
$100, where would you put it?
Obviously, prevention is worth half a cure. Absent prevention is worth half a cure. So certainly prevention is important, but we know that we can't prevent everything, so we need to be prepared. And so that's, again, my message is just be prepared for when things are put in place to prevent something happening when they fail, be prepared to do something else. So yeah, we like to prevent, but we can't prevent everything, so we need to prepare. And most of the time where this happens, so technological disaster was so unexpected. Don't play it back. We don't really have a lot of warning time. It just happened. So by then it's too late to prepare. You have your expertise identified, have them trained, whether it's medical, mental health, social services, economic services, the whole range of areas where you can be prepared. And the other thing about preparedness is it helps the community, not just when a hazard event occurs, but it puts the community up when there's nothing threatening them. It just helps build the community relationships, resources, social capital, cultural capital, things that are really the strong ingredients for a resilient community. So I see preparedness as part of this uplifting the entire community to be more resilient.
I had a quick question, but maybe a long answer, I'm not sure. But, you study technological disasters all over the world. In some cases, I would assume some places you see more corrosive communities than others. I didn't know if there were some factors that you saw where you would have expected it to be more corrosive than it wasn't. What are the differences between it? Like, for example, Cordova is a pretty corrosive situation. Are there some things that we can think about in the Gulf and nationally in the city that differentiate those factors?
Well,
That's that might be a loaded question too, but I'm just trying to think.
I think part of what made Cordova more susceptible to the corrosion was its relative isolation. You can't drive there, you either fly in or get in by boat. It's relatively small, so it's very insulated from. So I would expect more corrosion in smaller, more insulated communities. Then I would expect more corrosion when there's greater uncertainty about what's going on and what the impacts are. So you have multiple entities offering competing definitions of what's going on, really creating even more uncertainty. That's where the corrosion is more likely to occur. So it really has to do with maybe the isolated nature of the community and the degree of uncertainty and competing definitions of what's going on that would make things more corrosive or less corrosive. The corrosive community is in comparison to the therapeutic community that we typically see after a natural hazard event where community members pull together. In Oklahoma, we had more strong after the war tornadoes 6 years ago. And you just rally around each other and you lift each other up. There's some exceptions, but that's not what we find typically in technological disasters. Too much uncertainty and competing definitions.
Any other questions? And I do want to let you guys know, we've got a 1-pager and an 8-pager pub out there, because I'm sales lady today, that do talk about impacts of technological and natural disasters on communities and community resilience, so there is some discussion there about the difference between these therapeutic and corrosive communities. Let's thank our panel. Okay, so before I let you go hydrate, etc., I want to remind you that we are going to have breakout sessions after this. It looks like we've had a contraction of some of our players, so I ask you to go back to where you were